if we are going to make good for this winter, we better get on with it now.
The Registered Nurses Association of Ontario was the first to call for mandatory vaccinations for healthcare workers last month. Now, as more organizations join the push across the country, its CEO is not pleased Ontario's premier won't heed it.
I'm disappointed that the province doesn't have the guts.
So far, no province has made vaccination mandatory. Tuesday, the Canadian Medical Association and the Canadian Nurses Association put out a joint call.
We work in an industry that everyone that needs us is potentially susceptible to picking something up and having poor outcomes.
I think it's always challenging for governments to make these decisions, but I think our job as leaders in healthcare is to sometimes make difficult decisions and lead with science. And I think the science is clear.
Unlike Ontario and Alberta, BC hasn't shut down the idea.
It's important to me that we have all of this nailed down before we go into the fall respiratory season.
As for whether individual employers can act on their own,
there actually is quite a bit of legal basis to say that employers, if need be, can require vaccinations.
We know some healthcare workers are vaccine hesitant, but there's a lack of national data about just how many have their shot.
A lot of healthcare workers are marginalized women, so a lot of them have questions on pregnancy, fertility, and these are all valid questions to have, and all it really takes is having those one-on-one discussions.
Sabina Vora-Miller has helped many with questions like that decide to roll up their sleeve. She says the reasons some healthcare workers haven't been vaccinated are varied. It's a complicated issue.
Now, whether we have these healthcare workers who are working 100 hours per week and just don't have the time to go get vaccinated, or don't have sick time to go get vaccinated, or are worried how are they going to do their job if, they have a sore arm, for instance.
She believes the vaccination rate would climb if there was more education and paid sick days post-shot. Abigail Bimman, Global News, Ottawa.